presentation of colors. If we have any Native veterans or veterans in the audience who want to walk with the color guard, please assemble up here at the front to the left. So again, if there are any veterans who want to walk with the color guard, please come up here and stand behind the veterans. Thank you everybody for being here. If we could start moving now to the front of the stage where we have the table set up, that would be much appreciated. If we could pause where we're at right now so we can start the presentation of the colors by the Lummi and assembled veterans. Thank you very much. I'd like to welcome to the stage the chairman of Lummi Nation, Anthony Hilaire, and the chairwoman of the Lummi Commercial Company, Chairwoman Heather Layton.
Ait Squachil, Nischalicha CEM, Tony Hilaire, Sunnit Snat, Satsimton, Sunnit Snat, Chuck Lummison. Good morning, my dear friends and relatives. My name is Tony Hilaire. My name is Satsimton. I come from Lummi, chairman of the Lummi Indian Business Council. On behalf of our council, on behalf of our people, thank you all for being here today. Welcome to our home. Welcome to the Lummi Nation. It's a great sight to see, to have you all here with us at our home, to have some important discussion about the drug epidemic and the fentanyl crisis that we are seeing across Indian country and across this nation. We really want to thank the tribal leaders, all of the chairs and council members that are here this morning, for your leadership, for taking the time out of your day to make this a priority. We know in Indian country, as a leader, we have hundreds of priorities and so much work that has to be done in so little time. And this is why it's so important that we take the time to be together, to have this discussion, to see how we can partner, see how we can work together as sovereigns to address this drug epidemic. We are really pleased to host today the first Tribal Fentanyl Summit here at Lummi Nation, to bring everyone together, to ensure hope for all of our people, all of our constituents, to bring us closer to having one heart and one mind. And we work hard to address the disparities of our people, make positive change in the lives of our community, and we can do this together, and when we do it together, we can change the world. We all know the story. We all have that story in our families, a brother, a sister, a uncle, an auntie, a niece, a nephew, a child, gone too soon to the drug epidemic, to this fentanyl crisis, and there's nothing more beautiful than the love between a mother and her child. That day when a mother holds her baby for the first time, you can see them just glow, and that's what we want to protect. We have to think about the mothers today. As we do this work, it is really, really heavy stuff to talk about, but that's why we are here. We don't want to normalize the burying of our children, and it's a very serious indicator of the problems that we see when a mom has to bury her child, the mom who brings somebody into this world. And we all know these people that we don't want to say goodbye to, our future leaders, our future fishermen. They're the future leads of this family, the future language speakers, the future elders who are going to leave a pathway behind for all of us. And for a mother to have to say goodbye, a mother to have to bury their children is very, very hard to do. And it takes us coming together. It was months ago, and I really want to give a shout out to my fellow council member, Nick Lewis, who had this conversation years ago. And we would try and bring people together, whether it be at AT&I or NCAI or other conferences around here and around the nation. And we'd try and set something up like this, and there wouldn't be that many people in the room. And we understand that it's such a hard, complex issue to address. It isn't like COVID-19, a pandemic where you can wear a mask or get a vaccine or social distance and shelter in place. This issue touches every area of our government in Indian country. And so where do we start? And I think that's the trouble that we have. And so we're really thankful to see a room that's full of leaders, room that's full of state agencies that are taking the time to really think outside the box, to be creative and work on ways that we can address this drug epidemic together. As sovereign nations, as tribes, as the state, the agencies, and I see some local electeds here as well. Thank you for being here. You know, as sovereign nations, we carry the responsibility to take care of our people. And with that comes much, much needed work to ensure hope, to take action and make sure that we're doing everything that we can to stop drug overdose in our communities. And it starts with us. It starts today. It starts with us working together. So on behalf of the Lummi Nation, again, we want to thank you all for taking the time to be here, for your good heart, for your good mind in this work, and for that shared vision of unity that one day we're going to heal from this drug epidemic. One day we're going to stop this fentanyl crisis. And so thank you from the bottom of our hearts. Haishka Siyam. I'd like to introduce our chairwoman of the Lummi Commercial Company, Heather Layton.
So Aixquachil. My ancestral name is Sultanamet. I welcome you to the homelands of the Lactamish people. My given name is Heather Layton, and I'm a member of the Lummi Nation. Today, I welcome you as the chair of the Lummi Commercial Company. In this role, my board works to provide economic stability to our community with direct services and oversight of our tribal enterprises, one being the Silver Reef Casino. As the chair of this board, I welcome you to the Silver Reef Casino and this summit, where hospitality and generosity are at the forefront of our beliefs. I truly hope you enjoy your stay with us this week. Since time immemorial, my people have been the stewards of this land, this place we gather today, the Lummi Nation. As stewards of this land and the caretakers of ancestral knowledge left to us by people unseen, yet powerful in presence. With their guidance and from birth, we watch, learn, and absorb information from those put here to mold, shape, and help develop who we become. As a Lactamish woman in my culture, sharing those teachings and taking that knowledge and leading the work of what we believe to be important and most sacred comes with great responsibility. Today, we get to share in that responsibility. Quinato, helping others. It's what they've trained us to do, and there lies the work. Strengthening pathways to healing in the first Washington State Tribal Opioid and Fentanyl Summit. Again, Haishka for being here today. As stewards of this place, caretakers of our children, and leaders put here to break barriers and restore what has been broken and unjust, we gather as the protectors of our most sacred possession, our children, to face this crisis, the crisis bound by colonized systems. This work can be exhausting, emotional, and sometimes defeating. Yet here we are with an open mind and an open heart, and the willingness to partner, Indigenous and state leaders coming together to form an alliance for the betterment of all people, to fight the addiction that has impacted both of our communities. Together we are more, and separate we are less. That said, again, Haishka for being here today. As we partner this week to bring awareness and strategic pathways to address the fentanyl and addiction crisis in our communities, we must remember the importance of this work. Partnership, our children, our inherent responsibility, being caretakers of this place, and the commitment to developing healing pathways for our families to recover. In these next couple of days, as we venture down this pathway, uncovering our traumas, remember to take care of yourself in that work as well. And in closing, I leave you with the words of Wachelia, my mother. She often reminds my siblings and I quote, "What you don't know, you pass on to your children." So spend this week unfolding the complex layers of addiction, absorbing all there is to learn while problem solving and partnering to create pathways to help heal our people. Because what we don't know, we pass on to our children. Again, welcome to the Lummi Nation and the Silver Reef Casino. As a community known for generosity and hospitality, we welcome you to our homelands. Haishka. And we have a couple house cleaning items. In our indigenous families, we all know what it means when we tell our children their auntie's coming. We straighten up and we stand tall. We do what we're supposed to be doing, and we act as though we should be. Or at least that's what I knew when my mom said my auntie was coming over. So, in an indigenous matter and being true to who we are, I would like to introduce you to our aunties of the summit. Maureen Kinley, Vicki Lowe, Danica Brown, Candace Wilson, and Colleen Colston. Aunties are esteemed and honorable and beloved. And as my mom describes the aunties in our family, they are the poles that hold up the home. They are the poles that hold up the longhouse. They are our stability. Aunties are our guidance. They are the ones who caretake for us. They help guide us, to protect us, and respect one another because they love us. Sometimes that comes with hard truth, and sometimes that comes with hard love. Respectfully, we honor their presence at Quinato. As good relatives, these aunties will help keep time and support the groups as needed and make sure the event proceeds respectfully and a good way for all. So if you need anything in the next couple days during this time of sharing, these aunties can direct you to care and in a mindfulness space where good relatives will offer support. So if you need help and assistance this week in processing the information that you hear, or if you need help this week with finding a location, reach out to one of these aunties. So, Haishka aunties. In your program, the meeting rooms are generally all in this centralized location. Our chairman's room is going to be right outside these doors. Our director's room is also going to be right here outside these doors. And the theater room, there's two theater rooms, and they're right when you walk out this hallway, they're right there. There's two rooms divided in half. Something that might be a little bit complex on your room assignment is there is a north and a south event center. This is the event center, and when the time is right, there's a motorized divider that will come here and divide this room in half. So one will be the north and one will be the south. The restrooms are out these doors, just past the first machines. And we have a special room. Our committee is calling it the quiet room. And it's room 159 in the South Tower, which is the new tower to our facility. The quiet room is an intended place for anybody that just needs to go and retreat and process information. because we all know as we walk through this work and we get through some hard topics, there's going to be some very traumatic experiences and memories that might surface, and we might just need a time just to kind of regroup. So that room will be in 159, and it is again in the new tower. So with that, I would like to call up Sasatum. I'm saying it wrong. Estitumson, I'm doing the best I can. Daryl Hilaire. He's going to start us with an opening prayer. Haishka. Satsumton.
Well, if it looks like I just fell out of bed, I really did. I thought this started at 9 a.m., and here I am, you know. Haishka Siyam, Nostalgia Siyam. Thank you for standing, because we stand in prayer today. And we pray for our memory to begin with. We pray for those people that have gone on or are still with us but have fought this fight for our people. These people in our memory are people like Chief Norb James, Laura Wilbur, Laura Edwards, Dale Jones, Ernie Jefferson, Frank Jefferson, Willie Washington Cooper, Buck Washington, Margaret Pierre, Gordon Charles, Donna Cultee, Uncle Smitty and Aunt Lutie, the drug and alcohol-free and 93 people, Willie Lane, Rosalie Scott, Josie Jones, Matt McGrath, Diana Fair, Dr. Dakota Lane, the canoe clubs. There's so many, many more that we can see them in our heart. We remember them, we remember you, and we thank you in this prayer today. And in this prayer today, we all look to the Creator for two things. One, that we listen to the prayer. Let's pray for that today. We'll listen to the people. Listen to the people, because the answers to all of this today and the days ahead, for our children especially, lies within our hearts, lies within our minds. We are all truly self-governing, self-determining, and this call for unity is a mobilization of our minds and our hearts to gather the people, not here, but in the homes, in the streets, in the alleys, in those places where we need to find those that are struggling in this life, that we're going to walk with them together and bring ourselves out of this together. Because those things that are in our face and in our minds, those children that are born addicted, we pray for them. And we're going to save them. We're going to show them a better life, because we remember. We remember today and remember the days ahead. Siyam Nostalgia Haishka.
Good morning, everyone. First of all, I'd like to say to our Lummi leadership, Chairman Hilaire, to those that helped start us off, our veterans, Heather, Daryl, thank you for starting us off with the words that you shared with each and every one of us. I'm learning how we work with the state. As Daryl said, usually we don't have our meetings till 9. I'm onto the state saying be here at 6 o'clock in the morning and post colors at 7:45. You definitely did a good job in getting us out of bed, so I want to say thank you. I want to also say to each and every one of you, you have all come here from across the state. No matter where you are, I want to say personally thank you for being here. We're here for a reason that's bigger than each and every one of us. This is really about saving our children and the generations to come, to do more and stop the harm that we're seeing opiates and fentanyl cause each and every one of us. And much like COVID, where tribes helped lead in the COVID response, when we talk about the fentanyl and the opiate crisis, this is something else I think tribes can really help push the conversation that we see get stuck down in Olympia or back in DC. And I want to encourage each and every one of you that you're here from your communities to represent your people, whether you're on the tribal side or the state side or any community that you're here to represent. You're here because of somebody and the impacts of this. And the best thing that you can do in being here is use your voice to share the things that is on your heart and on your mind, and to speak up. I've gone to a lot of meetings across the state and across the country, and I don't see people speaking up like I believe they should be. And I want to personally challenge each and every one of you that when it comes to the time to speak, especially in the breakout sessions, use your voice. Don't sit idle, don't sit quiet. This is a time for solutions. Stories got us here. For those of you that were at Centennial Accord, that wasn't very long ago. And I want to say to our state leadership, thank you for answering the call at Centennial Accord when we said we need this space for this detailed conversation. You don't see conversations turn around that quick, and so I do recognize that with our state leadership and Aaron and all those that have been involved. And now that we're here, I really do want to challenge each and every one of you to know that your voice matters and it's needed. We need solutions because we are tired of seeing our children become so normalized with burying loved ones in our community. That's not who we are. Those aren't our values, and we're better than that. And this is a time for solutions and actions to come from this work that we're all here together for. And I just want to say thank you for being here. I know there's a million other places that you could be. You leave families at home, your loved ones to be here. And I want to say again, thank you for making this a priority and with your commitment to be here. And again, I'm going to stress it every chance I can. Use your voice, speak up on solutions, and help us with this. We can't do this alone. We can't do this through a health lens. We can't do it through a tribal lens or a state lens. This is all of us. And we're here together as partners for our people. I just want to say thank you, and I'll turn it over to Aaron. He will be my translator. For those that watched Pell when he was Obama's anger translator, that's Aaron for me. So he'll say a lot of the things that I can't say. So, Aaron? You want to introduce yourself? I did forget to introduce myself. I'm sorry. I'm really trying to keep it short because, as Heather said, how sacred our aunties are. I'm waiting to see if they have any quarters, as we know tribal leaders can speak a lot, and I don't want to get any quarters up here on stage. But my name is Nicholas Lewis. I'm a council member for the Lummi Nation. I have a few other hats. I'm also the chairman of the Northwest Portland Area Indian Health Board, and I'm the vice chair on the National Indian Health Board and the vice chair on tribal self-governance as well. There's a few others, but I'll keep it short for the sake of time. And thank you for the reminder, Aaron, and I'll let you translate the rest of what I wanted to say.
Thank you, Nick. I was warned by my wife and both my children before I came here that I have to slow down. This is me talking slow. It's going to get faster, and I'm not going to know that I'm doing it. So I invite this crowd to just slow me down if I get going. I want to thank the HCA staff for making sure I didn't have caffeine this morning. It was actually a very, very big deal. Hello, my name is Aaron Spark. I'm an enrolled member of the Chivak Native Village Kashinamute Tribe, and I'm the Office of Tribal Affairs Administrator for the Washington State Healthcare Authority. I want to thank the Lummi Nation for hosting us in their beautiful and bountiful lands, and the Office of the Governor for always saying yes to innovation, and to Councilman Lewis for starting a conversation with the Healthcare Authority Director Sue Birch and I at this past Centennial Accord. We agreed that a strategic partnership between the state and the tribes was needed to end programmatic and jurisdictional silos and galvanize our tribal and state officials to end the blight of opioids and fentanyl on our communities. Those conversations led to all of us being here today, and I want to welcome our tribal and state officials to the first Washington State Tribal Opioid and Fentanyl Summit. We are making history today, and all eyes are on us throughout Indian country. Tribal and state elected officials are together and under one roof to have a conversation about the disproportionate impacts opioids and fentanyl are having in our communities and how to eradicate this crisis once and for all. We intend for this to be a high-level government-to-government conversation, and because we have the governor here tomorrow for a directed work session, we are eliciting and cataloging our conversations into 4 different buckets. The first one is to have direct conversations with agency secretaries and high-level state executives to find out what is currently feasible within our state systems and programming. The second, we want to catalog where we need legislative interventions. State legislation can be brought up directly with the governor on day 2. For municipal, county, and federal legislative efforts, they are to be cataloged and be used by the tribes in their advocacy efforts and be brought up at the national summit that's going to be held at the Tulalip tribes in August. Number 3, we want to define a sustainable path for a partnership between the tribes and the state. And number 4, highlight areas of systematic and institutional change that are needed to break down barriers to success we are currently encountering on both sides for a directed conversation with the governor. Our main goal, the main takeaway for this summit, is to determine a plan of action to combat the opioid crisis that is robbing us of our future leaders. Let's use the strengths of our indigenous communities to show us the right way to success. With that in mind, I really do want to thank all of our aunties for being here. If you grew up in a tribal community like I did and had trouble listening and did very bad things most of the time, when you were walking home, you often got chastised and punished by those same aunties on your way home. So by the time you got there, you had your aunties who told you what was right, and they led the way. So they're going to be there for us to make sure that we're staying on the right path and that we're paying attention to the success of these conversations. Again, we are tribes and the state government sitting here together talking about things that are very hard to talk about. We are going to be outside of our comfort zones, and I want to thank our aunties for keeping us on course. A little bit of agenda housekeeping. Colville Chair Jared Erickson, who was a major part of our planning and the success of getting us all here today, came down with COVID on Saturday. So we send him our prayers and thoughts for a speedy recovery, and he sends his regrets. He really did try. He texted me this morning hoping that he tested negative for COVID, but he did not. He wants to make sure that he's here for us, but he also wants to make sure that everybody here is in good health. So he sends his best wishes and hopes for our success. With that, this means that the multi-jurisdictional justice discussion is now combined with the main justice breakout, with Councilman Lewis co-facilitating and Chair Erickson stead. There is no meeting in the tower room from 1 o'clock to 3 o'clock, but the session from 3 to 5 o'clock, the fentanyl crisis and community safety session, will be in the tower room this afternoon. Again, no tower room session from 1 to 5. That is a combined justice session this morning. From 1 to 3. Now, everybody in this room is here because they care and advocate for the health and well-being of our tribal peoples. It is time we do this in concert together, and I'm looking forward to the progress we make here today. Kuyana Chuknuk, thank you very much for being here. It fills me with so much love and hope to see us all together to care for our tribal communities. And if you don't know by now, I'm one of the people who helped plan this, and if it is a success, I will carry that and I will say it very loudly. If it's not a success, I'll find you a different name to talk to later. But with that, I know oftentimes I revert to humor because I need to. It is a defense mechanism. If you know me, you know that's where I go a lot of the time. And when you're talking about policy between tribes and the state, it's often an uncomfortable conversation, so I try to crack a joke quite a bit. But I want you to know that we're here together to do this as a community. We're not talking about sides anymore. We're talking about people caring for our communities. And I thank every single one of you who endeavored to be here today to do this together. Right now, I want to welcome our panelists and facilitator for the Opioid and Fentanyl Lived Experience session. This is the most important path for us to go down together. This will ground all of us in what we are here to do together. I want to thank each panelist for their courage to speak on how this crisis has affected them personally, their families, and their communities. Please welcome Senator J.J. Wilbur from the Swinomish Indian Tribal Community, who will introduce you to our panelists. Thank you, Senator. So if everybody can start making their way back to their seats, hopefully everybody got a good snack, had time for a break, and we're going to hop back into it.
Good morning, everyone. If you could please start making your way to a seat. We're going to get started here for this next panel, the State of Opioid Fentanyl Tribal Crisis Response. And a quick announcement, reminder as well. Tonight is Culture Night at our Wuklium. It's our community building. Wuklium means House of the Frogs. And that is located in the front of Lummi Nation School. And the address of our school is 2334 Lummi View Drive. And it's in your agenda that you all have. We'd love to have you all there for our culture night this evening. And as such, we are providing vans at the main entrance of the Silver Reef Casino at 6 p.m. For anyone that wants a ride, a shuttle to culture night. Again, 6 p.m. Vans will be located at the front entrance of the Silver Reef Casino for culture night at 6:30 p.m. at Wuklium. I also want to just take a minute to thank the panelists that were just up here before us. Thank you, Senator Wilbur, for moderating the discussion. It's the much needed discussion that we have to have on the tribal and state and federal levels. It's our story. It's the stories of our community. It's the stories of our people. It's the lives that we want to impact as leaders in this work that we're doing. You know, we want to make it better for the future generations. And some of the things that we heard are from the heart and a lot of unexpressed love. You know, when our people are struggling with addiction and they're out there in this world and experiencing the negative aspects of the world, we carry a lot of unexpressed love for them. You know, we just want to tell our people that we love them. We want to tell them that we're here for them and that we want to encourage them and give them, strength to overcome whatever it is that they're battling. We want to give them our strength. And that comes with so much grief, as our people are struggling in this world, that we're grieving from that, and also grieving from the things that have happened to us over the course of our history in Indian country. And when we come up here and we talk and we share our story, when we share our hearts, when we cry together, when we laugh together, it's healing. And we're really thankful for that panel this morning, because it's another opportunity for us to heal as a people. It's an opportunity for us to heal as partners in this work, and to be honest with each other. When we talk about solutions, those are the issues that we want to solve. So thank you for that panel. Thank you for the discussion. And thank you all again for being here today. My name is Tony Hilaire, chairman of the Lummi Nation, and I think we'll do quick introductions. I'll hand it over to our co-moderator, Chairwoman Gobin.
Hashudabitsi, Shehelilos Shehelilos is my tribal name. Terry Gobin's my English name. I'm the chairwoman of Tulalip Tribes. I wanted to talk a little bit about these last few years. Since 2007, first of all, Tulalip Tribes has 5,200 members, and since 2017, we had 41 overdoses. 25 of those were from fentanyl. And it seems in this, that's just through 2022, not counting how many we've already had this year. It seems like we at least have, it's almost like once a month, sometimes twice a week we're going to funerals. It's exhausting. Because the tribes, we take care of our people from birth to death. And we're at those events, and it's hitting a lot of our young people. I just recently had a great niece, 17 years old, pass away from fentanyl. But it just seems like we have it all the time. We're in a community of grieving, and what is happening is it's becoming the normal, and it shouldn't be that way. So we just recently opened up our MAP facility. We're really glad that that's here. Tanya Burns is our general manager. Where's Tanya at? Oh, right here. We just opened up in February, and they have 45 clients to date, and we're like at a third capacity, so we're just starting up. 48? Oh, we got 3 more. So, but it's saving people's lives. I've had, we've had several people who go through the MAT clinic and who, try the different treatment processes, but the methadone has helped get them off of the fentanyl and moving forward. It makes a difference in the lives, and they can become productive citizens in our community. But right now, the jails are the ones that are doing the detoxing. And we need, I don't know if it's us as tribes who have to do this, but with the state's help with funding, we need the tribes to say a couple tribes will do detox centers and a couple will do treatment facility centers, so we can share each other, because when somebody says, I want to go to detox, you want to get them in now. And then right after detox, you don't let them go. If you do, they're back out using. I've had that experience with one of my nieces who, it's exhausting for the family. And she used to work for our court system as a probation officer, and then she got in an accident and then got on pain medication and ended up on heroin. And she went through this whole time period, maybe 4 or 5 years on it, and she had broken all of her ties with our family, except for me. I was the only one that would still tell her I loved her, but still. So I helped over and over to get her into treatment. It doesn't take once, it's multiple times. And now that she has cleaned up, she got on the Suboxone, and it's harder to get off of Suboxone than it is the heroin. She tried to go into a treatment facility to detox off of that, and they actually upped her dose. And so that makes it really tough. But anyways, she's doing good, and now she's working with those homeless, and she's helping getting people into treatment, and that's her drive, and that's her passion. And so it's really good to see that turnaround. But I went to when she had 1 year clean, and there's these people in the audience, and they said, I remember when you were my probation officer. That was kind of a different turn, but it's good when we have those people who make it through, but so many people don't. And I know that we're working on the residential treatment center. That's the civil commitment center for dual diagnosis, which will have a lockdown from I think I'm getting an echo back, 90 days to a year. And I think this is a really good idea, and I know we're building it, and we do have some preference in putting some of our members in there for the dual diagnosis, but we actually need it to be for all of the tribes to have that. But it does have, you have to do it civilly committed through your court system, and but it has to be dual diagnosis, mental health and addiction. And this is something that's needed throughout. So I'm really glad that we're finally getting ready to, I think, break ground. I think we've jumped a lot of hurdles here, so we're close to getting that done. But a lot of times we have to use hard dollars instead of using any of the funds that are provided, because we need to get them into private facilities the next day. We don't want to, if you have that downtime, they're back out. But we need to increase the availability of detox and inpatient that accept Medicaid and dual diagnosis facilities, and more funding for prevention and harm reduction. Tulalip just recently we got 20 pallet shelters. That's for low barrier for those that are using, and we have had some success on getting some of those clients into treatment from that facility. But it's pretty close to being full with the 20 that we got, but these people were either homeless, living under the bridge, in the woods, or couch surfing. And so it's a challenge, but we're there with counselors ready to pull them in. We have 6 transitional homes, so right when they get out, but those are full, right when they get out of treatment. Then we have the Village of Hope, where we just put in a number of cottages. I think it's, I'm looking at somebody, 17 or 19. Is cottages, new cottages to help people for that next step up. But the really important piece we're missing here is making sure we have the housing for those that get out of treatment, and it's a secured, clean living facility. Otherwise, they come right back out and they're around the same people, and the game's on again. But I want to wrap this up with one last comment, and I really want to make sure that we share this information. So our police department has got a canine dog, and this has only been like within the last 10 months or 12 months maybe. But it really has helped our police force. And in that short period of time, his name is Buster. And then my great-nephew is the police officer who got to bring the dog home and get trained with him. But I think this is really important, Buster, because he's out there busting people. But they do it when there's any suspicion. That dog can go by a car and just smell it and stop. But in that time period, he's taken 8.3 pounds of meth, 4 pounds of heroin, 93,000 fentanyl pills, $120,000 in cash, 33 firearms, and a pound of cocaine off the streets. We're looking to share this information with other tribes and to partner with them. And, you know, they've called Buster down to King County to come down there to drug bust. So I don't know how, you know, if it's not being shared as much, but it has made a difference in our community. And the most of our busts come off of the, you know, around them delivering, you know, by the casino, or now we're stepping up our game and taking down the little dealers and just trying to get it out of the neighborhoods, because people are sick and tired of seeing it, and they want to make sure something's being done. We want to stop this, and the cartels in our neighborhood, in all of the neighborhoods that they can get to, those are the main drug sources. But there's a lot to talk about today, so I'm going to pass this off for introductions for everybody else.
Chairwoman, for that introduction, and just a quick note to kind of build off of that. The drug epidemic gets really complex, and that's something that we've learned at Lummi Nation, is the need for more drug interdiction to get drugs off of the streets and out of our reservation. But when you try and do that, especially like for here, just as an example at Lummi, this road here that goes all the way to the Lummi Ferry is a county road. And so how do we do that? Well, one, we're a sovereign nation and we will do it, but at times it can be frustrating, and there can be confusion between the different various jurisdictions between state and federal government. And so how do we work together to address the issues like that? And that's a big part of why we're here today. You know, we want to find solutions. We want to be able to do exactly what the chairwoman is talking about. And at times we need to work together, and at times we need to honor our sovereignty as well. We'll keep going with the introductions. We'll start with you, Dr. Shaw, and we'll work this way. If you want to give an introduction of who you are and what agency you represent, and some brief remarks. Aishka.
Good morning. Thank you, Chairman Hilaire and Chairwoman Gobbin. Thank you so much. You're still here. Okay. Thank you so much for opening. It's great to be here today. My name is Umair Shah. I'm the Secretary of Health for the great state of Washington, and I want to start by thanking Lummi Nation and being on the ancestral lands of Lummi people and hosting such an amazing and also such a critical event. This convening over the next 2 days is so important for all of us. I certainly want to thank Governor Inslee and his team for all the support that we have received as state agency directors. And I'm also here with our Department of Health team, part of our leadership team, as well as some of our staff members who are very committed to working on these issues and have been doing such a tremendous amount of work over the last several years on this and from a long-standing standpoint. I also want to thank our legislature in particular. I know that there are legislators in the room as well for such bold action that was taken during this legislative session to really take on behavioral health as well as substance use issues throughout, with the investment, but also the recognition of the support that's needed for communities across Washington. As Chairman Hilaire had mentioned, in addition to introductions, just an opportunity to share some vision. We know there are a lot of things that are a part of this challenge that we have throughout our communities across this great state. And we absolutely recognize that the stories that we heard just over the last couple of hours for the shared, the lived experiences were so powerful. The emotion when you lose somebody, the emotion when you have a family member who is affected, means that all of us are affected. We know that this is not just one person, this is not just one individual, but it's a family unit, people, a community. Certainly, ultimately, all of us together as a state are really concerned about what is happening, but most importantly, we know that it affects individuals. So we hear about numbers all the time, but it's really about individuals and people who are part of those numbers, and we can't forget those. And that's why it's so critical with the shared stories to remember that. So I want to just start by acknowledging just the importance of this work, and then my colleagues here who are always so committed to the work that we do together. I can't say enough about that work because the work is not one agency, it's not one group, one individual, it's not one leader, it's all of us together. And there's so much that we need to be doing together. I did want to just mention that there was a lot of talk and conversation today about culture, about the importance of family, about the importance of people coming together. And we at the Department of Health absolutely believe in that. It's whole of person, it's whole of community, and it's whole of response that has to be taken together. And so just so humbled and honored to be here, so thankful for all of you to be here with us, and really looking forward to listening, learning, but also responding in a way that's going to be appropriate to the crisis that we have. So with that, thank you so much.
Thank you, Director. Secretary, keep going down the line here.
Good morning. It's an honor to see so many beautiful faces, some old friends, some new friends, some distant cousins, I say, and some close cousins perhaps as well. It's a tragedy, however, that we have to get together to talk about this issue, isn't it? But we have to, because it is imperative that all of us together, as Dr. Shaw so eloquently said, do it together. This isn't the responsibility of one agency, one person, one community, one nation, one tribe, one government. It is the responsibility of every single human being for the benefit of our children and their future of this big land. I just had the opportunity to meet with others from the White House who are talking about the same issue. And it's tragic. It's tragic in every part of this country and the nations that are within it. It's killing our people, yes, and we heard a lot about that this morning. So one of the things that I think we have to discuss, and we will, are not only what are we going to do about the people who are inside this turmoil, but what are we going to do about the root causes? And there are many. Those root causes go back to colonial times. And they come forward to the present. What are we going to do? That's a big part of what we need to discuss. I didn't hear this morning much about xylazine, otherwise known as tranq in the street. You know what it is. For those of you who aren't familiar, it's what's being combined with fentanyl. And according to the White House Office of National Drug and Central Policy Office, that is, it's even a harsher killer than fentanyl alone. So the crisis is more than that. We really have to get a hold of this, folks. Now, with that downer, I can say that we are all intelligent human beings and we care, and I know we can do it together. We have to, again, for the benefit of our children and the future. We have no choice but to work together to do this. So I look forward to the day of learning. One of the very basic components or factors of change is education. Another thing that I haven't heard yet today, but we will. We have to educate the public. We have to educate our children. Do you remember the days, maybe I'm aging myself, do you remember the days when you couldn't walk through a casino without seeing a big cloud? Because there was so much smoke, cigarette smoke. Do you remember those days? Who remembers those days? I don't know. Okay. But I walked through this casino from one end of the complex to the other, and I didn't see that thick smoke in the casino. Why is that? Because we've evolved about smoking and how bad smoking is. We've educated our youth, we've educated others, okay? If we can do that with cigarettes, why can't we do it with this killer that we're talking about today? I know we can, but we have to do it together. So thank you for having me, and I look forward to a lot of good discussion.
Good morning. I'm Cheryl Strange. I have the pleasure of serving as the Secretary for the Washington State Department of Corrections. And I want to thank Chairman Hillier and Chairwoman Gobin. It's nice to see you. I had the opportunity to work with Chairman Gobin in helping get individuals who were in tribal jurisdiction in the jail to come to the Department of Corrections, where we could afford some level of treatment and secure housing and programming. So that has been a great partnership. And I think there's a lot of opportunity for that as we talk about this horrific disease. Fentanyl is a different beast. And I'll be talking later about the impact of fentanyl on individuals leaving Department of Corrections custody and residing in the community, going from that protective inpatient, if you will, institutional level of awareness and support and monitoring to life returning to normal, and fentanyl is destroying that. So we really must work on that. I also am grateful to the Lummi Nation for hosting this. My colleagues, as Secretary Menendez said, this is a we thing, and it is nothing we can do alone. I'm here with members of the Department of Corrections leadership team, particularly in the reentry space and the health services space. So we are an entity that a lot of contraband comes into the Department of Corrections. So living it firsthand, every prison is a mini city. And keeping fentanyl out of our prisons is a humongous effort here and one worthwhile. But it is something that happens every day. So we are just very grateful to be here, to be contributing to this conversation. We owe it to those individuals. You know, our sense of humanity, who we are as people, as Washingtonians, it is impacted, and it is very all-telling by how we treat our incarcerated, not how we treat our wealthy, but really how we treat our incarcerated. And again, more to come throughout the next 2 days. Just sitting here this morning, and it's always the value of people with lived experience, and that is the human-centeredness of us all. If we are listening to people impacted by this disease, they are the experts, and we are there to lift barriers. And it takes all of us in harmony and sync, doing that together. We must be organized. We have to be logical and sequential. We have to be focused on this. And I'm looking forward to the next 2 days. I've taken many notes and ideas in listening, as we do when we talk to people who experience it, and that concept of nothing about us without us, and how important that is to solving the problem. So thank you for hosting us. Chief.
Thank you, Cheryl. Good morning, everyone. It's an honor for me to be here with you today. To the chairs, thank you for the invitation to be here. To my good friend Sue, thank you for calling me. I appreciate this. We're here to learn just as much as we are to give information. I brought with me my command staff from my narcotics unit, Captain Wilbur and Lieutenant Matt Wood, and I also have one of my 2 tribal liaisons here. Patty Ghosh is not able to be here, but Don Pullen is here. This is very impacting. My heart goes out to the speakers, the panel that spoke earlier, and others who've been impacted by this situation. It's been very impactful to the profession as well. I lost a trooper coming in as chief of the organization in 2005 to an overdose situation. So it's personal. I've been doing everything I can to ensure that I protect my people, by ensure that I surround them with the proper assistance. We have a department psychologist, we have a chaplaincy program, we also have a peer support program. So we all need help. As a person who grew up in a small town in Louisiana, my folks, aunties, very important to me. I have a lot of aunties from where I grew up in Louisiana. And my mother used to always say, it takes a village. And in that village, you have a right to beat my kid's butt. If you catch my kid doing something wrong, I'm one of 9 children. You didn't dare do anything wrong on one side of town and didn't think my mother was not gonna know about it before I got home. So I understand the value of aunties. Again, this is very personal to the profession, very impactful. To all of the first responders who see this on a daily basis, we respond to these calls, we see folks who are dying, who've been traumatically impacted by fentanyl. I've been around long enough, I've seen pretty much all of the iterations of drugs that have come to the forefront. Crack, meth, cocaine, you name it. This is the worst by far, absolutely the worst. And so what we need to do is figure out how do we deal with the ones who are actually bringing it to our people's front doors. The cartel are doing tremendous damage to this nation in a big way. So I'm the chair of the International Association of Chiefs of Police Narcotics and Dangerous Drug Committee. And we talk about this on a regular basis and working with our federal partners and our state partners, but in particular our federal partners who have the ability to have personnel stationed around the world to try and learn what the cartel is doing, how they're doing it, so that we can try and break their cycle of success. So I'm very glad to be here with you today so I can listen and learn and help my peers determine how can we play a better role, a bigger role in being a part of the solution and never part of the problem. So good to be here with all of you. Thank you for the invitation.
Good morning, everybody. I'm Sue Birch. I'm the director of the Healthcare Authority. First and foremost, it's an honor to be up here with my colleagues. I know we have a few more that are on the Health and Human Services sub-cabinet. Ingrid Ulrey is here, and I see Secretary Hunter back there as well. And it's really important for you all to recognize that this group really works together, also with partners from labor and industries, and we work over towards OSBI. We really try to reach further than just kind of the health and human services sector, because we realize just how enormous this challenge is. So I want to first and foremost, I want to recognize another sector that's really important. But people don't realize that 22 years ago, Dr. Gary Franklin from L&I sent the first data sets to the federal government saying, I think we got an opioid problem starting to brew in this country. So Gary, I would ask you to stand and stay standing. If you're an incredible addictions doctor like Dr. Sharisa Fatinos, or the docs that are at all of our sites in detox, could you please stand up? Because these are not usual doctors. These are doctors that understand whole person care and addictions. If you're a nurse, if you're a peer supporter, if you're a policy nut like Amber from the governor's office, who's a lawyer but a social worker, please stand up. If you're a peer, and I see so many of you out there, and family members that have been helping, please stand up. We have our behavioral health administrator, Chris Shear. We have our opioid coordinator. You guys stand up. There are so many people in this room that are doing direct care, or their actions are really magnifying direct care. There's so many more that aren't standing, but thank you guys. There are legislators, and I know Rep. Macri, you're back there quietly. There are people that are really championing this culture shift that we have to create. And so this morning, as I was listening to our amazing panel, thought, this really is about us creating the same level of intensity around treatment and response and taking it even further than what we've been doing for the last years and building up the capacity. And as you've seen the MAT sites go up and the successes that they've had, it's extraordinary. So we have to make these kinds of services more uniform across the state. We also have to really step up our efforts around housing, because it's really tricky. People don't want those types living anywhere near them. And so we have to step up our efforts with folks at Commerce. We have so much more work to do around supportive services and all the workforce supports, all the extra types of creative complementary healing. And so the Healthcare Authority does serve in a unique role because we try to bend our federal partners to come with us in this journey. We try to convince them to think about healing and recovery. And while we're doing treatment and while we're working together collectively for treatment and prevention, we have to really step up our efforts to help people in Washington know that we are at this and we are demanding more hope and we are creating a better path, and that, quite frankly, we're not going to live like this. And Nick said it the best when he started, which is we are better than this, and we demonstrated it. I hate to take us back to COVID, but we demonstrated it with COVID, that we could kick butt and deal with COVID, and that was a painful process. And now we really got to turn to and work on this. So that's who I am. The team I'm with, all of these teams are amazing because it's all these people that are passionate about this work. But we got to recommit to focusing this work and getting more shit done. Excuse me, I guess I'm the nurse that gets stuff done. So I also want to just say one last thing. Daryl Hilaire came up and handed me this beautiful book, Jess and Tell. Am I saying that right? Anyways, it means to learn and grow together. So it will be the theme of our next year's summit. And this came from the Sage Elders and the Children of the Setting Sun Productions. But really, we are here the next 2 days to learn and grow together. But Godspeed, we have got so much work to really hasten and to deliver, because every day lives count on us. So thank you for being here, and we're honored to work with you. And wherever Nick is and the team that also went to Iceland, I'm sure we'll be talking about what other countries are doing to really create this massive culture shift. And we're better than this. So I look forward to our time the next 2 days.
Thank you. Thanks, Director, Secretaries, and Chief for the introductions. Couldn't agree with you more, Chief. I am more terrified of my aunties than I am my own mom and dad. And I have a lot of them. My dad had 7 sisters, and also all the community leaders that I call auntie, with the greatest amount of respect. We want to make them proud, and so we're definitely terrified at times when we are not acting right. I also wanted to make a point that as tribal leaders, we struggle sometimes with this need for having to constantly tell our story, where we're always lobbying, and it starts with who we are, where we're from, our population, the Treaty of Point Elliott, 1855, sovereignty and self-determination and self-governance is just like a standard talking point that we have to do throughout the state and federal governments. And it's not like that for us in Indian country. It's usually our parents, like my dad, Daryl, and our Secretary Jones and his dad, who was late Willie Jones Sr., who was a longtime leader at Lummi. I have my Auntie Candace Wilson, who's here, a former council member at Lummi Nation. My Auntie Juanita, she's on a lot of our CBCs here. She's a former leader. We're always there. Our values and our reminders from those who paved the way for us are just constantly there. And when there's the pendulum swing in state and federal government between the Republicans and Democrats, it's always a struggle for having to start from the beginning every time that we go there. And a big part of this reason for today is to try and get to better understanding of each other. And I was reminded just now from my Auntie Candace, who works in the State Department of Health now, wanted me to just mention a couple of things that we're talking about healing here. We already know of the atrocities that have happened to us throughout our history since settlers came here. We know of historical trauma, and now we want to talk about historical healing. And for generations, since time immemorial, for thousands of years, we have been self-sufficient. We have always taken care of ourselves. We know what to do. And the stories that we heard today about not wanting to feel shame, wanting job opportunities, and wanting more access to treatment, we're not bad people trying to do good. We're a people that have been sick, and we're trying to get well. And in addition to that, wanted me to remind the tribal leaders and state leaders here that these are the issues that we face. These are the systems that have been created to come up against us as Indian people. These are the systems that we inherit as leaders in the state and the tribal governments. And we really hope that the state knows that us tribes can be relied upon. And a great example of that is COVID-19, how we were able to mobilize and think outside of the box and get access to people who need care, who need help. And for us at Lummi Nation, we vaccinated everyone in the surrounding communities here, not just the Lummi people. Anybody who lives in this area, we took care of. In addition to that, this place that we're in right now, we had cold weather emergencies, flooding, power outages, and we opened this door of this place that we're in right now to all of Whatcom County so that they have a roof over their head and they have food and water, a place to stay while we address the issues. we can be trusted, when we're looked at as a way of taking care of all people, then I hope that we can really find some solutions together. And at times, we want our state leaders to stand up for us in meetings or in systems that our voice is not included, to advocate, to pound your fist on the table and say, well, where are the tribes at with this? We want the state to not only do that, but at times get out of our way. Let us be a sovereign nation and exert our sovereignty so that we can take care of our people, what we have been doing for thousands of years. And with that, I think we'll jump right into the questions. I'll start with Director Birch. The subject matter, health services spending and health system transformation. The first line to address addiction is through the family. We know how important it is to empower and strengthen people who are experiencing addiction to access resources and help themselves. And our question to you is, in your role overseeing health systems transformation and recognizing that recovery cannot be siloed, how can you help create the pathways necessary to strengthen families and people who are experiencing addiction?
Thank you for that question. I think the state has demonstrated that we are moving towards greater person-centeredness, and that we've really invested a lot into kind of unique tribal and community needs. We try to come alongside when tribes ask us, but also yield to what is it that the tribe is doing. Many times this morning, people have brought up DigiWitch Clinic, which I visited probably 5 years ago when it was just beginning. And it is truly state-of-the-art in the nation, and I look forward to getting to some of the other MAT sites that have emerged since then. But I think that we want to continue to be responsive. We want to allocate resources. We've got to do this in partnership. It just simply can't be federal to state, state down to tribes. It's got to be done in partnership. Like we stood together on the very contentious issue around the DHATs, our dental providers. We won that lawsuit. It was a very long battle. We will stand aligned with our tribes on issues against our federal partners on the needs that we have that we disagree on. So we really will be there ongoing in the conversations. We also believe strongly that the healthcare systems have to keep integrating behavioral health and substance uses disorder into service delivery. So we've heard it again and again at the sites, and we're seeing it out of the detox treatments too. We just can't look at the narrow kind of physical health needs. We've got to look at the entire needs of a person and worry about, okay, do they have a great supportive employment opportunity, because they got to have purpose when they get through this recovery. Do they have kind of stable and permanent housing? All those other things that aren't traditional kind of medical things that historically the state and federal government through health insurance coverage has been poised towards. So we want to keep going deeper into behavioral health integration. We also have a big body of work, again, done in partnership with all the other HHS agencies around how do we identify the gaps and work deeper in collaboration around those solutions for the most vulnerable and for the hot spots around the state. And again, greater investments in health promotion, primary prevention, treatment, overdose intervention, harm reduction, recovery supports, and crisis services. These are the things we are building capacity on, and that simply have to be in place so that when somebody goes in and says, I'm ready today, that begins then, not weeks and months like we've heard. So these things are really important, and we're not there. We aren't there systemically in the state, and we'll get there, but we have to really keep up on these things. And then I will just say that we want to keep working deeper on things like some of the traditional Indian medicine solutions. These things to our federal partners are oftentimes very difficult discussions because they don't understand the uniqueness of our ways here in Washington with our tribal partners. And so I think that's going to be an ongoing conversation as our country keeps embracing more around diversity and the unique special needs that tribal communities need and are entitled to.
Thank you, Director. And a quick note before we go to the next question. These questions were developed by tribal leaders, and I think we've noticed in the past that a lot of these conferences that we have, it's usually just a report out from the state or federal government and doesn't really give us much voice, but I want to reassure the tribal leaders here that we gave some real thought for some of these questions. Chairwoman?
I wanted to thank Secretary Birch on her comments there. And one of the things that we didn't mention a lot of, and that kind of mentioned there, was prevention and education. And that's the way we're going to stop it in the future if we don't do it now. But a lot of those kids are being raised in homes that the fentanyl are, the addictions and use. I mean, my daughter had a friend who both of her biological parents died from heroin. And then when she got a little bit older, she said, I'm just going to try heroin. And I said, why would you even do that? My daughter's so against anything like that, but we were telling her, why would you do that? And she's in addiction now, and we keep on having, these young ladies are having addicted babies. And then the social services that we're going to have to put in the future if we don't take care of it now. So that's just one of things we really have to concentrate on, because we either take care of our needs now or we take care of them later. So, okay, I would have a question for Secretary Shaw. What steps would you take to strengthen mechanisms across the whole state of government, not just health departments alone, to direct efforts to address the complex needs of those experiencing addiction and in recovery?
Thank you, Chairwoman Gobin, for that question. A few things come to mind as I'm hearing colleagues and also reflecting again on this morning. I completely agree, this is not a public health department issue alone. This is an all of us issue, and I think we've already said that. And even the breakout sessions when family, culture, housing, homelessness, justice, treatment, prevention, et cetera, that really speaks to that this has got to be a holistic view of how we approach things. I was an ED physician, emergency department physician through the VA hospital, taking care of our veterans for 20 years. And I will tell you that our veterans and the challenges of behavioral health and substance use has really been an eye-opener, and not only was it an honor to serve our veterans, but it really shaped my medical and health view and perspective on things. It is not a medical issue alone. If we believe that we're going to be able to medicate ourselves out of this, we are completely off the mark. We have to have a holistic view on this. Secretary Meneses had said that this is about root causes. Chief Batiste mentioned the importance of law enforcement coming together as being part of the solution. All of us as secretaries recognize that it is not any one piece of this. We have to come together. So in public health has a key role, though. Why? Because we do believe in the root causes and what we call these social elements, these social factors that come in and really impact health. We call them, in our language, social determinants of health. But what's really funny about social determinants of health is that we get shocked when they actually determine health. What? Housing, transportation, education, poverty reduction, all of these have such an important impact on health. And so when we are thinking about and recognizing the importance of addiction, when we're recognizing the importance of behavioral health and mental health, when we're recognizing the importance of substance use and substance misuse and overdose, we have to bring all of those things together. What I'm also wanted to mention is Governor Inslee in 2017 launched a poverty reduction plan as well, and all of our agencies are a part of that. And that has continued to be the reminder of how important that poverty elimination, it's not even reduction, it's elimination, is so critical to this. We have to do everything we can to help people with the very economic pieces, the very social pieces that come together. So we've talked a lot this morning about clinics and the importance of MAT clinics and substance use clinics on tribal lands, and I want to say how critically important this is. Chairman Hilaire had mentioned this earlier. COVID-19 was not easy. COVID-19 was very difficult and continues to be difficult for many people across this country of ours and across the globe. Tribal nations came together to help serve people across systems and in neighborhoods, communities that were not just tribal people, but beyond that. We know that's so critical, but it's also what's happening on tribal lands, but we also recognize what's happening beyond the tribal lands because it's all a system. Everything impacts each other. Dr. Gupta, who heads the National Drug Policy Center for the White House, he recently said something which I thought was very interesting. I think Chief Batiste might like this. Maybe even Cheryl Strange might like this, that we have to have a heads and tails strategy here. Heads because we know addiction is impacted by our brains, but a tails strategy as well because all those drug traffickers, we're going to kick their tails. So we have to be thinking about this as both together. This is about the medical and the health and the social coming together, but we have to also be thinking about those very substances. How are they getting into our communities, and what can we do to support the very frames to be able to respond? Let me get back to the clinics. The clinics are such a critical piece to that because they are not just where medical services are delivered, but they're also where social activities occur, where people come together for economic, for social, for jobs, for education, for health awareness, for awareness in general. And I see Councilman Lewis here as well, and so he also has taught that importance of all of it coming together. We have to be thinking about the holistic approach to the individual, to the family, and ultimately to the community. So, respectfully, I absolutely agree. If we are going to make this a singular health issue, we are going to fail. It has to be all of us together.
Thank you. Chair Hilaire?
Thank you, Secretary. The next question is for Secretary Strange regarding reentry, care coordination, and going in and out of incarceration. There are high numbers of overdose when people are released from jail. Individuals' tolerance has shifted during even very short periods of non-use of fentanyl. We are concerned about the number of individuals who are losing their lives or experiencing overdose post-release from jail. So what collaborative actions or steps can you take in order to help improve support for safe care and safe release and diversion planning to link people at risk to treatment and or intensive wraparound to support seamless transition which connects them to health services and bridges jail to behavioral health support?
Thank you, Chairman. I'll start with I think the solution is universal, but I will clarify that the Department of Corrections runs the state prison system. It is independent from the jails. Jails are typically run by counties and cities, and the state runs the state prison system. And really the rule of thumb there for those who may not understand that difference is if a court sentences you to 365 days for a crime, if it's 365 days or less, you go to a jail. And those are run by counties and cities. if the judge sentences you, and typically in a felony, to over 365 days, so 1 year plus a day, and anything beyond that, you'll come to a prison. And so that's just a little difference there. And we in the Department of Corrections work closely with our jails around a variety. We have similar problems and similar challenges. And what I will tell you is the solutions remain the same, regardless of whether it's jail or prison. I'm going to start with some very practical things, just to give you a sense of there are about 13,000 individuals incarcerated in the state of Washington at a prison. And the majority of those individuals are men. I think we house right now about 750 women. The Department of Corrections also has community service individuals who leave prison are often sentenced to a community jurisdiction situation. You might know it as parole, but it's that same, you're on probation, if you will. And what we see in those situations is the need for, what we heard this morning, we heard about immediate access to detox. We heard about those immediate access to the right level of care, regardless of what setting you're in. So the Department of Corrections, I'll talk about the prison side, because you're going from a very protected environment, and certainly drugs, we work very hard, and it takes a lot. Drugs do come into the Department of Corrections to individuals. Someone who is addicted and a family who is trying to find that balance between enabling and supporting, drugs come in, and all kinds of drugs, fentanyl, crack, heroin, marijuana, the gamut of mind-altering and killer drugs do come in. So as people come into the prison system, an assessment is done. You know, we're not living in a world of great electronic access. This group, I'm so excited, is trying to change that so that we can have good access to electronic services. But we learn about addiction or drug use when someone comes into a prison. So it's part of the assessment. It is not enough. There is not enough service for that. We need more of that, and we'll be talking about that. We also offer treatment for substance use disorder while in prison. If a person needs detox, we will know that right away based on the medical assessment when someone comes in. So we will make sure that individual gets that care. As they go through their prison stay, and it ranges anywhere from 2 years in prison, 0 to 2 years, to life without parole. And so there's that full gamut of individuals. Some individuals are with us a very short time, others are with us a long time. And we offer treatment. We use a contracted provider, and we need more of it, and that's why we're here, to understand that. I'm very excited that on release, we have different kinds of sentence alternatives, meaning an individual might be diverted from prison. Other individuals come into prison and have a quick step down out. And that is where we are most vulnerable, and that is in the transferability of an individual from incarceration to the community. And you will, in the workshop later, we'll talk about some of the data related to that. We were able to just get in this latest legislation, and thanks to everyone here, we were able to get 120 navigators, and they are helping to navigate. And, so prioritizing, we have to figure out a way to prioritize, lethal problems such as fentanyl. And, it is well-rounded. There is just simply not enough of it, and it's not timely yet. It is for some, but not for everyone, and I think that's where we're trying to aim for. I'm very excited about the opportunity for Reentry 2030, which is a national initiative that brings together at a national level what Dr. Shaw was talking about, social determinants of health, treatment, housing, mental health care, residential treatment, whatever that level is, bringing us all together for successful reentry and successful public safety. I mean, we know that drug addiction, in order to fulfill a drug addiction, is a felony. People commit crimes. And that, so you'll see that with us. That is many. 60% of individuals that are incarcerated have a substance use disorder. 60%. So reentry, I want to just very lastly mention the most exciting thing that happened, and it happened very recently, as President Biden signed S-1165, House Resolution 2400, the Reentry Act of 2023. And what that did is it affords incarcerated people, again, it's the bill, we have to implement it locally, and Director Birch is leaned into this very hard with us on incarcerated individuals receiving services covered by Medicaid. And that is a game changer for incarcerated individuals. Their services would be covered 30 days prior to their release from jail or prison. And this is an opportunity to expand substance use and mental health care. And Director Birch is challenging the state of Washington to actually try to get a waiver up to 90 days. And Washington has been an innovator. And, we have done a lot. And as we do this, our counties and our ASOs, all those folks that make the safety health network in our state, as corrections is able to get access for incarcerated, so will come the jails.
Secretary Strange, I just want to comment that Cheryl's team is implementing a movement around peer supporters. So there is extensive work being done at all of our departments around community health workers and these peer supporters, and they are in the prisons and make an enormous difference. When you can have a navigator or a peer or a community health worker be right at that person's side and go through the process. So that's a huge piece that both of us are working on together. And we are not talking too much about our re-entry opportunities under the Medicaid waiver yet, because it's not a done deal, but we are in active discussions to really push our federal partners in this re-entry piece that she spoke about, because it will also be a game changer. If somebody can leave that setting and go out knowing who their behavioral health provider is, with the housing pieces set up, with the medication pieces set up, and it will just really improve their opportunities going forward.
Thank you.
Okay. I want to thank you for your words, because when we were putting people in jail, could be up to 3 years, and it was just sitting in a cell, where the services that are offered there can help our people to come back into society and all of that. But we also, what the other members of the panel were talking about is the root causes. And if you do not take care of those mental health issues, they can go through treatment, long-term treatment, and they will reoffend. It'll happen all the time. if you don't get to the counseling that's needed. So I just thank you for those words. So my next question is going to be for Secretary Menendez, and it's about social service, safety net, elder care, youth service, ICWA, and culturally relevant service delivery. So the question is, what role can DSHS play in helping to eliminate the adverse social determinants of health in our community's experience? Determinants.
Thank you, Chairwoman. As my colleague, Dr. Shaw, mentioned, social determinants of health are very, very important in our society in order to have a safe society, a healthy society as a whole. And what are they? What are they? Well, housing, we talked about that. A person has to have a house to live in, a good place to live in, safe place to live in. Health, we talked about health, and that includes physical, oral health, yes, and behavioral health, right? Employment, we have to have employment. Otherwise, we can't feed ourselves, perhaps, unless we're independently wealthy. Few of us are. And we have to have food security. If we don't eat, we die. The Department of Social Health Services impacts all of those. We have community service organizations throughout the state, as you very well know, including in some of your reservations. And our goal is to be able to provide all of those four things, or to provide referrals to those who can provide to the individual. That's key and important. And right now, some of those things, some of those factors, benefits, are actually at risk. Some of you heard about the debt ceiling dilemma that we're facing in Congress. And guess what? That food security that I talked about is at risk right now. SNAP benefits are going to be cut, potentially. So if we continue to question those social determinants of health and how they impact our society, like perhaps certain members of Congress are doing right now, then we are going to continue to impact poverty, and poverty being one of the major factors that impact or make opioid and drug addiction in particular relevant. You know, OUD happens in every segment of society, regardless of socioeconomic, right? You can go to surgery, be the richest person in the world, and get hooked on an opioid. However, the biggest factor of risk is poverty. And so if we don't address those social determinants of health responsibly, guess what? We're not solving some of those root causes that we've started talking about. We absolutely have to be ahead. We've got to address the root causes that are making this crises worse. And poverty being the major. And poverty, one of the factors of poverty, as you very well know, is in intergenerational poverty, but also intergenerational factors in racism that have been some of us have faced. So we have to address all of that in order to address the epidemic. We cannot be complacent when somebody says we're going to cut the food security, we're going to cut SNAP benefits. The Department of Social Health Services, one of the key benefits that we issue is SNAP. That's nutrition, that's food. The number of people coming into our community serving organizations right now have more than doubled. We cannot keep up with the demand. Some of our brothers and sisters are waiting up to 8 hours when they come into our office because it's so crowded, including members of tribes. In fact, this afternoon we will share some of the data. DSHS, along with our sister agencies, is lead on poverty reduction in the sub-cabinet. In fact, Councilman Nick was part of preparing the 10-year plan that gets into these social determinants and gets into reducing poverty. And that plan was created with people from all parts of the community, not just state workers like ourselves, but rather people with the lived experience, including folks who have addiction and who face poverty, so that we can get to the results in a quicker fashion. So I want to reiterate, those social determinants of health are key to breaking the cycle of this opioid epidemic. And I might add that there are some cities in the United States where more people have died of opioid than they did of COVID-19. Think about that, including San Francisco, California. I was in San Francisco last week. If you walk across from City Hall to the Civic Center BART station, you see people injecting right in open air, right there, no matter what. Shirts open, doing it. And so San Francisco has has put together some of the very best, they've tried everything, I should say. And they're really ahead of us in many ways in Washington on prevention. But yet, the crisis is even worse. I hope that answered your question. Where'd she go? Chairwoman.
Thank you. I'm sorry I had to sit down. I'm having a knee issue, waiting to get a knee replacement, and standing up is kind of aching.
Thank you, Secretary, for that comment. You're absolutely right. This issue cannot be piecemealed. It has to be all of it. All of the barriers and gaps that we see have to be addressed, and especially the basic needs of living, of taking care of our people. And so thank you for that comment. We have our final question here for Chief Batista. The fentanyl epidemic is fueled by the cartels who have monopolized drug distribution up and down the I-5 corridor. So there's a two-part question here. I wanted to ask, what can you do to address the supply factors that are fueling the drug epidemic in our state by cartels and online dealers, as well as what facets of current laws and legislation are insufficient to deal with this crisis, and how can they be strengthened?
Thank you. Great question. In terms of what can we do to cut off the supply line, as I mentioned earlier in my opening statements, it's evident that the cartel is one of the key suppliers of fentanyl. We know that, particularly in this state, starting back in 2017, we started to see it really take form and shape here in our state. And then, of course, over the course of the last 2-3 years with the pandemic situation, what we're seeing in our crime lab in particular is off the chart. The potency of the fentanyl, the number of people who are affected by it in terms of fatality collisions on our highway systems, and by the way, last year was one of the highest number of deaths on our highways since 30 years ago. And most of that is fueled by people driving under the influence of drug and alcohol. So we need the assistance of and collaboration from one another, just as we did after 9/11. The 9/11 report told us within this business that we needed to set our egos on the shelf and start to communicate and collaborate and work together. Same thing needs to happen with this in terms of us working as a profession with each other up here on this panel and with you as members of the community. We don't have all the answers, but by collaborating and listening to one another, I think we can come up with the answers slowly but surely. This is a huge problem. When you talk about the number of lives lost more than COVID, that's a put down your cup moment. That's a serious moment. So what can we do about that is a question that we all don't have the answer to. But I think by more interactions and conversations like this is how we get to a place that we got to with 9/11. We put our egos on the shelf and we started communicating with one another as that report told us to do in terms of intel gathering and seeing what was it in terms of threat to this country and what could we do to abate it. And we work more closely with our federal folks, particularly folks over in Europe, our partners. We work very closely with them. New York Police Department didn't stand by and just wait for others to take care of their problem. They put attachés across the world in places that they felt were a threat to them. So those are some of the things that we need to think outside the box in terms of how are we going to help solve this problem. It's a very expensive one and it's a costly one. You look at what we've seen on our highway system, the governor has assigned us to work with other agencies in dealing with people who are houseless. We really saw the increase in that over the course of the last few years, again, with the increased use of opioids. The number of lives being lost as a result thereof. So there are no easy answers, but I think collaboration and cooperation is the main key. And then for those who are experts up here within their own lanes, I leave that to them. I'm here to partner with them, but I'm here to partner with my professionals within this business that I'm in. What was this? Did I miss the second part?
Yes. The second part of that question was, what are facets of current laws and legislation that are insufficient to deal with this crisis, and how can they be strengthened?
Well, as we just saw with the struggle that was had this past session that caused a special session with the Blake decision, I'm hoping that we're on the right path now with regards to results that came out of the special session where you're going to be allowed to deal with, in terms of the crimes of possession and usage from a gross misdemeanor perspective. I fully agree that there has to be a combination of treatment. You have to have a carrot and a stick type approach to this, because communities are crying about the amount of crime that they're facing within their communities. Businesses are yelling about the amount of crime that they're confronted with. And in my business, we're expected to solve those problems, or at least be a part of the solution. And it's not an easy thing to solve. So whether or not the Blake decision in terms of the direction we're going is going to work, time will tell. Only time will tell. So it's my hope that it's progress. It was a struggle for the past couple of years. And so I think with the combination of ensuring that people who are in need have treatment made available to them whenever and wherever they need it is critical. But for those who are habitual offenders that the community feels like they're being victimized by, there's an expectation that that be dealt with as well.
Thank you. Thank you to the panelists for all of your comments and remarks today. Can we give them a round of applause, please? We appreciate each of you taking the time to be here with us. I think it's really important, and we hope that you walk away never forgetting about us as tribes and the work that we're currently doing and the work that needs to be done. And we really hope that the tribal leaders that are here today, the tribal governments, that this has sparked some ideas or some follow-up work that's probably going to be needed after hearing from our state leaders here. And even if it's frustration, even if it's concerns or questions that you may have, that we can follow up with our state leaders who it's been bestowed upon them to be leaders in the state and to make sure that all of our needs are being addressed in this state, but also to look at us tribes as partners and as good neighbors so we can get some of this work done. And also thank you to Chairwoman Gobin for moderating with me today. If we can give her a round of applause, please. And thank you for your leadership and your comments in regards to how to address the drug epidemic as well. Each tribe is different, but we still carry some similarities in how it impacts our people, our culture, and ways that we want to address it. And real quick, I also want to acknowledge my Auntie Evie. Speaking of angry, I don't want to make my auntie mad. If you can wave your hand, Auntie Evie. She's a former chairwoman of Lummi Nation, council member, and What happens, at least at Lummi, I don't know about the other tribes, but we serve in this capacity of leadership, and then when we step away, we become council members in recovery. And after that, we give a helping hand to the effort. And she's the crisis outreach supervisor at our behavioral health department. And so that's something to know as a state, that when we step in these positions of leadership, that when we walk away, we don't go far. We're still here, still in a leadership capacity to make a difference. And we always carry that pressure, we always carry that value and that teaching with us everywhere that we go. And it's not made up, it's not just a talking point that we thought of randomly. It's something that we're just continuing the work, continuing the legacy of our ancestors. So thank you all. Thank you all for taking the time to be here for this panel, for this important discussion. And we're hopeful that some change will be made. Haishka Siyam and Ischalicha. Thank you.
Thanks so much, and I am acutely aware that I think the only thing standing between you and this wonderful lunch are my remarks. So I'm going to shorten them up. But first, let me say that what most prompted me to get up this morning and drive up to visit you all is really just to say two words, and those words are thank you. Thanks to each and every one of you for what you're doing in your role to help address this epidemic. I just really appreciate that. Speaking as an Attorney General, also as a father of young teenagers, I just really appreciate that. Also, of course, want to thank Lummi Nation for hosting us. Please give another round of applause for the chairman, Lummi Nation, for opening up their beautiful facility for this. We so appreciate it. And all who made this event possible, the Healthcare Authority and many others. There are many members of my team here from the AG's office. I will not introduce them all. There's too many of them here. But I do want to mention Asa Washins, who's my tribal liaison, who's been very involved with this, and he'll be co-hosting a panel or leading a panel, I think, right after lunch. And Asa does fantastic work with a whole number of folks from my team who are here today. So I think it was 2 days ago, I was at an event near downtown Seattle, and folks were there to talk about some issues facing the state of Washington. And the woman who was hosting this event start off by talking about the opioid epidemic and her son who suffers from addiction and the impact that's had on her and her family. That night I flew to Eastern Washington. The next morning I was visiting the Kalispel tribe in the northeast corner of the state. And we had a small gathering there to talk about some state issues, and the person who was hosting that meeting, leading the meeting, brought up opioids and talked about his child who suffer from opioid addiction and the impact on their lives, the community's lives, and his life, obviously, from that addiction. So two totally different locations, two totally different meetings within the space of a handful of hours in different parts of our state, one very urban, one very rural, exact same comments. And I know you know that, but we often talk about the statistics, and statistics can be mind-numbing in a way, but behind those numbers, there are obviously real people and communities and families who are deeply impacted by this epidemic. And that is what motivates me and my team to do what we can to help on this issue. I've got some numbers of the epidemic, but my guess is you've gone over those this morning. We'll hear from them again. But it's worth pointing out that this epidemic did not just happen out of thin air. It wasn't just some terrible accident that happened. There are corporations, large corporations, powerful corporations, who fueled the opioid epidemic across the country and right here in Washington state by not playing by the rules in pursuit of profits. That's a fact. And so in using our role as the Office of Attorney General, it seemed to me that one thing we all agree on in addressing the epidemic is we need more resources, right? For treatment, for prevention, you name it. You know all those issues. And for us, it seemed to me after many conversations with folks who have been impacted by the epidemic, it seemed to me that we should really lead the nation in holding those entities accountable, filing litigation against those entities, and bring additional resources to our state so all of you and many others can put those resources to work to help bring an end to the epidemic. I won't go through all the lawsuits we have filed, but there have been many that my office has filed. We've sued entities like Purdue Pharmaceutical, the makers of OxyContin, the Sackler family, Johnson & Johnson, multiple Fortune 50 corporations who all in different ways fueled this epidemic. And the goal for these lawsuits have been twofold. One, to hold them accountable for their conduct, and number two, to bring in significant resources to our state. Now, I think we can all appreciate that no dollar amount is going to bring back lost loved ones or loved ones who are suffering from addiction, but they can help stop the epidemic and help save folks who are suffering from addiction. And these resources are critical to addressing the challenges that we're all facing, that you are seeing in the work that you do. So when you see these lawsuits, other AGs have filed lawsuits as well. And what often happens is there's a national settlement where all the AGs get together, Republicans, Democrats, they get together and they reach an agreement with, let's say, Purdue Pharmaceutical, or the three largest distributors of opioids. And they reach an agreement because these companies want all the states to settle. They don't want to have a few out there still suing them, taking them to trial. Some of those deals I've accepted, but a few of these, the largest, Purdue Pharmaceutical, Sackler family, the distributors, I said no to those deals. I rejected these settlements, which is a path that's not without considerable risk. If you take those corporations to trial, and trust me, they have resources to defend themselves and to make life very, very, very difficult for even the best legal team to hold them accountable for their conduct and delay trial and delay accountability. So it's a hard path to take them to court. But that's what we did in a couple of the biggest cases. Because we did that and took them to trial and rejected national settlements, we ended up getting settlements that brought in more money for Washington, significantly more money for Washington, than we would have had we taken the national deals. As a result so far with our, thank you. To give you a sense of scale, the case with Purdue and the Sacklers, we rejected national deal, led a small group of states challenging the settlement, won. They had to reach a new deal with us that brought in an additional more than $1 billion across the country, and more than $100 million of that comes to Washington because we led that challenge, that lawsuit. That's just one of the cases. Overall, we've now recovered more than $1 billion from these cases, and we have more cases going, okay? I'm not gonna go through them all, but we have more cases going. In structuring these deals, one thing that's been critical to me is that every dollar from these settlements, we write these settlements out, and in the language of the settlements, we put in there, the money can only be used to address the opioid epidemic. So when the state gets a big chunk of these dollars, they cannot use it for some other general fund purpose. They can only be used for all the things that you're working on. That's the only way it can be done. And that's how we're gonna get at addressing this epidemic, is using these resources. And tribes are, I think the first 65 million the state allocated this past session, I think 15 million of that is going to tribes all across the state. And that's how we're going to get at this issue, working together, getting you the resources that you know, you're the experts. I'm not the experts on what to do with this $1 billion. That's you and the implementation and addressing it. But I want to leave you with, before we break for lunch, is that if I give a speech anywhere in this state, if I'm at a Rotary Club anywhere in Washington State, and I talk about the opioid epidemic and talk about these cases, I can guarantee you what will happen when I'm done speaking. It is literally without exception, and I've done this a lot. At the end of the meeting, people come up and say hi to me or something, and somebody always kind of hangs out and says, can I talk to you for a second? And they kind of pull me aside a little bit from the group. And what they will tell me is some version of my son, my daughter, my spouse, my colleague, my cousin, me, suffer from opioid addiction. And they want to share with me what that impact has been. And they want to say, they always say, keep bringing those cases. They want the accountability and they want the resources to help save their kid or their loved one or somebody else's if theirs is gone. And so, speaking really primarily as a father to all of you, I just so appreciate the work that you do. The one thing that scares me to death is my kids suffering from one of two things, mental health issues or chemical dependency. Those are the two things I see with my friends who have kids who struggle with that, like, oh my God, right? You almost feel helpless. So the good news is we have people like you who are using the tools that you have, the resources you have, really to fight for people who really need it and for our community. So for that, I'm very, very grateful. I so appreciate the chance to say a few words with you and say thanks for all the work you're doing. Have a great lunch, everybody.
It's always going to be a challenge to follow Bob Ferguson with how much he has done for the state of Washington. So I just want to say, Bob, thank you for everything you've done. Thank you for holding those companies accountable and protecting people from across the state from this issue. I did want to just make a few more comments before we break from lunch. As I mentioned this morning, and I know starting at 7:45 was really early, I learned what the state does is we're going to say it's going to be really early just to make people get here earlier. And true as I heard, we started to see it fill up around 9 o'clock. So, but now that everybody is here, I do want to do a reminder to each and every one of you that are here. We are going to break for lunch in a few moments. But now that we're going to get to the breakout sessions and the discussions, that's where the work is going to take place. And I want to encourage and ask or require each and every one of you to use your voice. You're here on behalf of your people, whether you're on the side of the state or the tribes or the cities or the counties. This impacts all of us, and as we've heard time and time again, we need to do this together. And so that when we go into the breakout sessions, do not be shy when it gets to the time to ask questions, to engage. You are all part of the solution, and we need your voice on behalf of all of us. And so I just want to make that very clear to each and every one of you. Do not be shy to bring your voices, your concerns, your solutions, most importantly, to those spaces. I also want to just, and I know it was mentioned earlier, out there we have a kind of like a memorial wall. If you have lost a loved one to fentanyl or overdose, anything else that we're battling, please fill out the ribbon out there to put it on the blanket that's out there. When we do formalize this report after this summit, we want to make sure to honor each and every one of those names that are on there. Those are the people that we're here for as well. And just because they're gone does not mean that they're forgotten, and we want to make sure that we honor them with this work. I would also like to mention we have a room, I believe it's the executive room right here. And as you got to see most of the secretaries, we got to hear from the AG. We have a few more that are in the audience. We have legislators here. It's hard to have a conversation, and I know that's where a lot of the work really gets done, the side conversations. I know some of them may see me running back and forth in the background. I know that's not the most respectful, but I'm trying to get some work done. But we do have that room open, so if you are here on behalf of your tribe and you want to have a conversation, and any of the secretaries or state leadership have the ability, that room is open. If it's open, go ahead and use it for any of the conversations that you may need on behalf of your people. And it was mentioned earlier, we do have Culture Night tonight at 6:30 at the community building. For those that might not know where it is, you can ask the people at the registration if they can help you with any of that information. We are going to have a beautiful Culture Night, and we want to see each and every one of you there with us tonight with our youth and showing how healing our culture is and how that is medicine. And with that, I do not want to hold up lunch no more, so if I can ask Shirley Bob Hyaltza if you can bless the food so that we can break bread. And then we'll have a lunch, and then we'll start back up at 1 o'clock in all the breakout sessions and look forward to the work taking place. Thank you.